When a woman goes through menopause, the ovaries stop producing the estrogen and progesterone that a woman's body normally has. And this can cause a lot of symptoms for women. Now, for women that are having symptoms, this can be treated by replacing back the hormones that the ovaries aren't making. That's called hormone replacement therapy, or HRT. Hormone replacement therapy in the recent past underwent a big change in the way that we think about it. And what happened was, we used to think that hormone replacement therapy was good for all women, that anybody through the menopause should be on hormone replacements because, number one, it makes you feel better, and number two, we thought that it also treated certain conditions and would make you live longer. And so we were giving it out kind of like a vitamin, basically thinking, hey, everybody should be on this, sort of like a daily vitamin, and there really wasn't any harm in giving it. It turns out that when some of the big studies came through, that our thinking about it was really not correct, and that indeed it can treat the symptoms of menopause, and for most women treat it very safely. However, like most medications, there are some small risks and some side effects to HRT, to hormone replacement therapy, and so it's not really like a vitamin. And so there was this huge backlash for a while where everybody panicked and everybody was taken off of their hormone replacement therapy. But as time has gone by, we've started to get a better feel for when we should use it and when we shouldn't use it. So women that have no symptoms at all really don't need hormone replacement therapy. However, if a woman is miserable with menopause symptoms like hot flushes or night sweats, some women are having a hard time even getting to sleep at night or having a decent amount of sleep because of their hot flushes and their night sweats, hormone replacement therapy can fix those complications. It can also help with vaginal dryness, it can help with some vaginal irritation or even pain with intercourse. And so these are things that hormone replacement therapy can help. There are some small risks of hormone replacement therapy. It slightly increases the risk of stroke, it slightly increases the risk of heart disease, and slightly increases the risk of breast cancer. When you look at the statistics, if you have 10,000 women that are taking hormone replacement therapy, out of those 10,000, you'll see about 7 out of 10,000 events. In other words, of those 10,000 women, 7 of them are going to have some kind of adverse event like a heart attack or a stroke that won't have anyway. So 7 out of 10,000 is pretty small odds, but it certainly isn't zero. And so it's something that you want to weigh. But hormone replacement therapy can certainly fix the hot flushes and the night sweats and the vaginal symptoms that come with menopause. Now, there's a lot of ways to give hormone replacement therapy. The most important medication in the hormone replacement therapy is really the estrogen, because that's the medicine that makes you feel better. So replacing the estrogen that your ovaries are no longer making will help take away the hot flushes and the night sweats and the vaginal symptoms. However, in a woman that still has her uterus, in other words, someone who has not had a hysterectomy, giving estrogen by itself is dangerous because it can lead to a significant increased risk of uterine cancer. And so in women with a uterus that we're replacing estrogen, we always add back also some progesterone, just a small amount, and that progesterone keeps the uterus from developing a cancer or a precancer, and that keeps it very safe. Now, the only time that we don't do that is when we're using an estrogen vaginal cream, and we'll talk about that because it doesn't absorb into the blood system like other estrogen products. So that's the big picture of hormone replacement therapy. It's the change in thinking about how we use it and the idea of what it can treat.